In this video, I'm going to give you the 5 best exercises for degenerative disc disease. If you've been struggling with pain and stiffness due to degenerative disc disease, probably because you're approaching it wrong. Listen, it's not your fault. You may have been given the wrong exercises. You may have been told to do the exercises in the wrong order. A lot of people don't even know there is an order. We'll talk about that. You may not know which exercises to start with. We're going to fix all of that today. If you implement every exercise that I share with you in this video, you may start to experience pain relief, increased mobility, and freedom of movement fast. In this video, we're going to cover them all. In fact, these exercises helped my client Adrian achieve significant pain relief in just a couple weeks. The same exercise routine helped Angela improve mobility in just 3 weeks. And the exact same thing may happen to you if you simply implement the exercise routine that I share with you in this video. But I will warn you, if you skip just one exercise in this video, it could be the reason that you continue to suffer with your pain and stiffness. Now, before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and deal with debilitating back pain, neck pain, and how to avoid drugs and surgery. I literally upload a new video every week. In addition to that, I've created a free health vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link in the pinned comment below. If you're suffering with pain and stiffness because of degenerative disc disease and are looking for quick relief, keep watching this video. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario. These 5 exercises have been specifically chosen because they effectively relieve pain and stiffness in the spine, the back, and the neck while slowing down the progression of degenerative disc disease. Follow the sequence of exercises closely because they're designed to be done in a certain order at a specific time to help with slowing down the progression of spinal arthritis and degenerative disease. Now, you may start to notice over the next few days that you may experience relief of back pain, improved mobility, and a significant reduction of stiffness. Let's get started. Welcome to my home gym. So as we're about to discuss the 5 best exercises for degenerative disc disease, there are a few tidbits that you actually need to know. So number 1, if you haven't already watched my 3 causes of degenerative disc disease, please go do that. Understanding how these conditions actually come about helps you determine which exercises to do. And the truth is there are a lot of videos on YouTube right now where the exercises aren't necessarily specific to degenerative disc disease. So when I say degenerative disc disease, that is no different than osteoarthritis or spinal decay or spinal deterioration. They all mean the exact same thing. Now, also, very important, if any of these exercises hurt, they should not cause pain at all, then stop doing them immediately. And hopefully, and strongly recommended, you should also go to a health professional who specializes in these conditions. That's not necessarily your average MD or therapist or chiropractor. Let's find someone who's specific to this sort of condition. So exercise number 1, you want to warm up. I know that's so strange, and I know no one's telling you to do that, but understand what we're doing is in degenerative disc disease, you have a lot of stiffness, you've got a lot of lack of mobility and so forth, and people think warming up and stretching are the same thing, and they're absolutely not. You want some blood flow going to the muscles. That's why actually doing your stretches in bed when you first wake up is not necessarily a good thing. So we want some warm up, we want some blood flow. That can be stationary bike, that can be treadmill, that can be walking in place, that could mean just simple arm circles and so forth. Something that's easy on the body so that you're not causing any strain, but getting some blood flow to all those muscles, to that spine. The whole idea is a warmed muscle is going to stretch a lot better. So please, number 1, a simple warm-up. They're 2 separate things. I know you thought, growing up, a lot of times, warming up for a sport, you thought we're going to stretch. No, warm up first. Something as simple as 3, 4, 5 minutes. That's all you need. Right? It'll get some blood flow going to the area. You'll find it'll help relieve the stiffness. That's why you'll find one of the classic signs of osteoarthritis or degenerative disc disease is that you're going to be stiff in the morning. And you'll find once you're up for about a good half hour or so, that stiffness starts to ease up a little bit. You've got some blood flow going to the area. So number 1, I know it sounds so simple, but please do a warm-up. Exercise number 2 for degenerative disc disease is the cat stretch. Now, again, for some, that's going to seem so simple, but guess what? There's a reason why cats are as limber as they are. So in a cat stretch, what we want to do is, again, think of what we're doing with the spine. On one part of the movement, the vertebrae are actually coming forward like such. On the next part of the movement, they're actually coming backwards as such. Okay? And what we want to do with any stretch is we want to hold that stretch for long enough that we actually feel the stretch. So we're going to get in on all fours, and then what we're simply going to do is round the back. And you're going to round the back to the point where you feel a good stretch. So the vertebrae are actually separating. You're actually feeling a stretch in the muscles. We're going to hold that for at least 10, maybe 20 seconds. But the truth is we're not going to count. We're going to wait till we actually feel that ease up. And then we're going to do the reverse, where we come back the other way. And we can even come in. You'll see the cats also come down in this movement as well. We're getting a stretch in the spine. And again, for a good 10, 20 seconds, but we're going to feel the movement, and then we're going to repeat that. We're going to arch back up, okay? They're going to come back, and we're going to arch back down again, okay? And we want to feel that stretch in there. So it doesn't matter if it's 10 seconds, 15 seconds, 20 seconds. Actually feel the stretch. Actually feel the separation of the vertebrae. Remember, in degenerative disc disease or osteoarthritis, what's happened is those vertebrae, those discs have thinned out significantly. Sometimes it's somewhat of a thinning, sometimes it's significant thinning where we have spurs or osteophytes. Sometimes it's bone on bone. Okay? So you've got to take that into consideration as well. Go to the point where you feel a good stretch, where you feel some separation, not to the point where you're actually starting to jam those bones in there as well. So you've got to pay attention. It's not go through the motions. Feel everything that you're trying to feel. So number 2, cat stretch is great for that. Exercise number 3 for degenerative disc disease is the knee to chest. So what we're going to do is we're going to lie flat on our back. You're going to have your knees bent like so. And then what we're going to do one at a time to start is we're going to pull the knee to our chest. You can have this knee bent if that's more comfortable. You can bring it down, which is going to give you more of a stretch. Again, you're going to hold this stretch, as we talked about in the last exercise, 10, 20, maybe even 30 seconds. We're actually trying to stretch the muscles on the back of the thigh when we do that. And again, we can also play with this stretch. This will be a slightly different stretch if I come slightly outward, if I come slightly inward. If I feel the stretch ease up, then I can actually pull a little bit further. And then we're going to alternate to the next leg. And again, we're going to hold that stretch for a good 10, 20, 30 seconds. We're going to repeat this at least 5 to 10 times. If the stretch eases up, I can pull a little further. I should feel these muscles start to ease up. What we're attempting to do is we're attempting to stretch the muscles of the thighs and the legs. We may even get some stretch into the glutes. We may get some stretch in the low back as well. This is nice and easy stretching. Okay? With degenerative disc disease, this is not about any forceful strengthening. Okay? At this point in time, we want to get mobility back into the discs. So we want to get that flexibility. So again, nice and simple stuff. You can even do a double knee to chest if you like as well. But again, we're going to repeat this a good 5 to 10 times, and again, go to your tolerance. Exercise number 4 for degenerative disc disease is your pelvic tilt. Now, I know you've probably heard to do these in a number of different exercises. Think of what's happening again in degenerative disc disease. You've thinned out those discs. For some people, that's a little bit. For some people, that's a lot. For some people, they've actually created spurs, or what we call osteophytes, so those bony spurs trying to fuse the spine together. For some, it's bone on bone. The more movable and flexible we can keep the pelvis, the better off you're going to be. Also understand how many muscles attach to the pelvis as well. So on a pelvic tilt, people sometimes get this confused, because you can have both an anterior and a posterior pelvic tilt. So again, we're going to lie flat on our back. What we're going to do is we're going to actually move the pelvis either forward or backwards as we do this. So in the one movement, essentially what I'm doing is I'm flattening my back directly against the mat. And again, I'm going to hold this for at least 10, 20 seconds. I'm going to go to the point where it's comfortable. Don't forget to breathe. So many people hold their breath when they do this. Then we're going to reverse that, where we're going to actually arch the back off the mat. And when we do this again, go to the point of tolerance. This is again why I stress it's so important to find a good healthcare professional, whether that's a neurofunctional chiropractor, a corrective care chiropractor, a therapist who has more expertise than the average in this type of thing, an MD who has more expertise than the average MD in this type of condition, because that's going to be important, that it's not just the basic advice that you're getting. And again, now we're going back where we're flattening that back against there. And as we do that, we're either tilting the pelvis one way or the other way. either anterior or posterior as we do that. That's actually getting movement in the pelvis. Remember, the pelvis supports your spine. It's important to get that movement and mobility, especially if you're suffering with degenerative disc disease. And exercise number 5 for degenerative disc disease or osteoarthritis in the spine is one of my favorites, especially for a lot of my athletes, but also for the everyday office worker as well, is what we call your hip flexor stretch or psoas stretch. Psoas actually starts with a P, P-S-O-A-S. Where this becomes really important is the psoas muscle is the hip flexor, the muscles in here. Okay? So they actually attach to the hip, and they actually come up and attach to the vertebrae in the lower part of the back. And for most people, all day long, what they're doing is they are contracting these muscles when they're sitting. And when that happens, when they stay contracted for too long, they actually start to inhibit the glutes. So if, for instance, if my bicep was always contracting, when my tricep learns to always relax, that's not a good thing. So getting hip flexors in good shape are essentially important here, because otherwise you're just creating a lifetime of problems, especially in degenerative disc disease. The more we can have that whole core area working properly, so that the glutes aren't inhibited, so that the psoas actually has some flexibility to it. Now, a lot of people will simply do a simple standing stretch. I'm going to show you a modification that I love to do for myself as well, because we want to get more of a stretch in here. So what I do is I actually use a weightlifting bench or some type of table. I will actually put the one leg on the table, okay, and then I'm getting a stretch in through the psoas muscle as I come forward. I arch back a little bit so that I get that stretch in there, not to the point where I start jamming any of the vertebrae in the lower part of the back. And then what I can also do is understand stretch doesn't just come from changing the angle of the joint. A stretch comes from literally stretching the muscle. So I almost think of my knee being glued to the table and actually also coming forward. And when I do that, I'm feeling a great stretch in there right now. And again, I want to hold this for at least 10, maybe 20, maybe 30 seconds. But again, I don't even need to count. I'm going to hold this long enough until I actually feel that muscle ease up. And once the muscle's eased up, I know that I've accomplished exactly what I want to accomplish. We would then switch to the other side. We would repeat that again, a good 5 to 10 times. Again, always to your tolerance. Don't go through the motions. You actually want to feel the good stretch, but by the same token, any of these exercises should never cause pain on you. That old adage, no pain, no gain, does not, never has, never will apply to these exercises for degenerative disc disease. You are now armed with 5 of the best exercises for degenerative disc disease, the same ones that I give to my patients. We've seen fantastic success with them doing this as well. Okay. Please take each of them nice and easy. Make sure you're getting a good professional opinion from a qualified health professional as well. In the comments, let me know which exercise gave you the most relief. Was it exercise number 2, the cat stretch? Was it exercise number 5, my specific version of the hip flexor stretch or the psoas stretch? Please tell me in the comments below. If you found these exercises useful, please do like and share this video. Help me help more people get relief of pain and stiffness from degenerative disc disease. And go ahead and subscribe to my channel now so that you can get more tips and strategies on how to deal with and how to relieve debilitating back and neck pain without drugs or surgery. The next video you should watch is this one right here. Okay? This, you'll see my unique 7-step non-surgical treatment for lumbar spinal stenosis. This 7-step treatment is applicable to many other things, including degenerative disc disease, disc bulge, disc herniation, scoliosis, sciatica, back pain, and leg pain. Please go watch this video.